Carpal tunnel syndrome. The best treatment options. Carpal tunnel syndrome is numbness, tingling, weakness, and other problems in your hand because of pressure on the median nerve in your wrist. The median nerve and several tendons run from your forearm to your hand through a small space in your wrist called the carpal tunnel. Click here to see an illustration. The median nerve controls movement and feeling. Click here to see an illustration. In your thumb and first 3 fingers. Causes carpal tunnel syndrome. Pressure on the median nerve causes carpal tunnel syndrome. This pressure can come from swelling or anything that makes the carpal tunnel smaller. Many things can cause this swelling, including illnesses such as hypothyroidism, rheumatoid arthritis, and diabetes. Making the same hand movements over and over, especially if the wrist is bent down, your hands lower than your wrists, or making the same wrist movements over and over. Pregnancy. Symptoms. Carpal tunnel syndrome can cause tingling, numbness, weakness, or pain in the fingers or hand. Some people may have pain in their arm between their hand and their elbow. Symptoms most often occur in the thumb, index finger, middle finger, and half of the ring finger. If you have problems with your other fingers but your little finger is fine, this may be a sign that you have carpal tunnel syndrome. A different nerve gives feeling to the little finger. You may first notice symptoms at night. You may be able to get relief by shaking your hand. Carpal tunnel syndrome diagnosed. Your doctor will ask if you have any health problems, such as arthritis, hypothyroidism, or diabetes, or if you are pregnant. He or she will ask if you recently hurt your wrist, arm, or neck. Your doctor will want to know about your daily routine and any recent activities that could have hurt your wrist. During the exam, your doctor will check the feeling, strength, and appearance of your neck, shoulders, arms, wrists, and hands. Your doctor may suggest tests, such as blood tests or nerve tests. Treated. Mild symptoms usually can be treated with home care. You can stop activities that cause numbness and pain. Rest your wrist longer between activities. Ice your wrist for 10 to 15 minutes 1 or 2 times an hour. Wear a wrist splint at night. This takes pressure off your median nerve. The sooner you start treatment, the better your chances of stopping symptoms and preventing long-term damage to the nerve. You also may need medicine for carpal tunnel syndrome or for a health problem that made you likely to get carpal tunnel syndrome. Surgery is an option, but it's usually used only when symptoms are so bad that you can't work or do other things even after several weeks to months of other treatment. Carpal tunnel syndrome from coming back. To keep carpal tunnel syndrome from coming back, take care of your basic health. Stay at a healthy weight. Don't smoke. Exercise to stay strong and flexible. If you have a long-term health problem, such as arthritis or diabetes, follow your doctor's advice for keeping your condition under control. You can also try to take good care of your wrists and hands. Try to keep your wrist in a neutral position. Use your whole hand, not just your fingers, to hold objects. When you type, keep your wrists straight, with your hands a little higher than your wrists. Relax your shoulders when your arms are at your sides. If you can, switch hands often when you repeat movements. Increases your risk. Things that put you at risk for carpal tunnel syndrome include health problems or illnesses that can cause arm pain or swelling in the joints and soft tissues in the arm, or reduce the blood flow to the hands. These include obesity, rheumatoid arthritis, diabetes, lupus, hypothyroidism, and multiple sclerosis. Being female. Women between the ages of 40 and 60 have the highest risk. Pregnant women near the end of their pregnancies often have short-term symptoms. Women taking birth control pills, going through menopause, or taking estrogen are also thought to be at risk. Hand and wrist movements and activities that require repeated motions, especially in awkward positions. Smoking. It may contribute to carpal tunnel syndrome by affecting the blood flow to the median nerve. broken wrist bones, dislocated bones, new bone growth from healing bones, or bone spurs. These can take up space in the carpal tunnel and put more pressure on the median nerve. Tumors and other growths. These uncommon causes of carpal tunnel syndrome are usually benign. Normal wear and tear of the tissues in the hand and wrist caused by aging. Call your doctor if you have tingling, numbness, weakness, or pain in your fingers or hand that keeps coming back or that has not gone away after 2 weeks of home treatment. Have gradually developed little or no feeling in your fingers or hand. Cannot do simple hand movements, or you accidentally drop things. Cannot pinch your thumb and index finger together, or your pinch is weak. Exams and tests. Carpal tunnel syndrome is usually diagnosed using medical history. The doctor will ask about any medical problems or illnesses, prior injuries, current symptoms, or daily activities that may be causing your symptoms. Hand diagram. You may be asked to help fill in a diagram of your hand to show where you have numbness, tingling, or pain. Physical exam, including comparing the strength of both hands. More testing. If your symptoms are severe, if non-surgical treatment has not improved symptoms, or if your symptoms aren't clearly caused by carpal tunnel syndrome, your doctor may recommend nerve testing, which checks the median nerve. X-rays. These can check for bone problems caused by past injury, arthritis, recently broken or dislocated bones, or tumors. X-rays aren't used to diagnose carpal tunnel syndrome. Ultrasound, to look at the size of the median nerve. It is inexpensive, comfortable, and quick. But its use for carpal tunnel syndrome diagnosis is still unproven and fairly uncommon. MRI. This imaging test can find swelling of the median nerve, narrowing of the carpal tunnel, or problems with circulation of blood through the carpal tunnel. Blood tests. These are sometimes done to check for a thyroid problem, rheumatoid arthritis, or another medical problem. Treatment overview. The goal of treatment for carpal tunnel syndrome is to allow you to return to your normal function and activities and to prevent nerve damage and loss of muscle strength in your fingers and hand. Treatment options include home treatment, such as changing or avoiding activities that may be causing symptoms and wearing a wrist splint. Physical therapy. This includes ultrasound, stretching, and range of motion exercises. In some clinics, these therapies may be done by an occupational therapist. Surgery. Surgery is sometimes recommended when other treatment hasn't helped, if you've had carpal tunnel syndrome for a long time, or if there is nerve damage or the risk of nerve damage. Other treatment. Other treatments for carpal tunnel syndrome include physical therapy. This includes ultrasound, stretching, and range of motion exercises. In some clinics, these therapies may be done by an occupational therapist.